All right, Derek, thank you. Well, anyone who remembers the nonstop coughing and the watering eyes, or perhaps being stuck inside for weeks at a time, can testify to the smoke impacts from our 2017 fire season.
However, now we're starting to see some expert research which uses data to confirm what we've all felt in western Montana, the health effects of weeks of severe fire smoke. Last summer's fire season was one of the worst in a decade, not just because of the number of fires and the acres that were burned, but for the severity of the fire smoke which choked western Montana valleys from the middle of July to the middle of September. Much of that problem was made worse because of the concentration of the largest fires in west central Montana, with huge places like the Lolo Peak Fire and the Rice Ridge Fire pumping tons of smoke into the air every day. Seeley Lake was especially hard hit, with air quality readings hitting levels that experts didn't even think were possible for days on end. Now researchers are analyzing the actual readings to gauge the harmful effects of the smoke on Montana residents and firefighters alike. Tuesday night, University of Montana Health and Human Performance Professor Brent Ruby and Clinical Associate Professor of Medicine Paul Smith will discuss wildfire implications for firefighter and community health. The program runs from 7 to 8:30 in the University Center Theater on campus. It's going to include a question and answer session. It's part of the UM Alumni Association's Community Lecture Series, which is focusing on wildfires between now and the end of March.